Welcome to this part of the Normal Labor and Birth Conference 2020, and it is the interesting part of the oral presentations. Over the next 2 hours, we've got plenty of oral presentations all lined up, and we would be having the question and answer session for this part of the presentations. And we would like to thank all the authors who have submitted their research work, very interesting few of them, and we have enjoyed looking at them, and I'm sure each one of you will enjoy. Each of the authors will have 5 minutes for the question and answers. And the judges for this session are Professor Eugene De Klerk from Boston, United States, and Dr. Mala Arora, New Delhi, India. And the first oral presentation for the day that goes on live is 038, Dr. Karen Winter, receiving, and the title is Receiving Maternity Care in COVID-19 and Experiences of Women's Partners and Other Support People. Over to you, Dr. Mala.
Hello, Karen.
Hello, Dr. Mala.
I had the pleasure of looking at your...
Is Karen Winter here?
Yes, she is.
Yeah.
And is Dr. Mala here?
Yes. We're both here.
Go ahead, Mala.
Okay. Karen, are you with me?
Yes, I'm here. Hello, everybody.
So it was very interesting, your presentation on the impact of COVID-19 and the effect on partner support. And I think the same sentiments have been echoed in the two theme presentations on COVID during the conference as well. My question to you was, how many of your patients were COVID positive?
How many of our patients or how many of our partners, Mala?
Well, both. I wanted to ask both. I mean, did you have discordant couples?
All right, finally.
We didn't have couples as such, so we recruited women and we recruited partners, and then among the partners, I think from memory there were only 2 or 3 that had positive tests.
Okay.
There were probably maybe 10% had been tested for COVID, which means they'd been in contact with somebody who was positive. But that was the first wave, so there were not as many cases as there were in the subsequent wave. So only a couple is the answer.
Okay.
Thank you for that, Mala. It is, I think fathers and other support people are being increasingly recognized as very important people. They're not just visitors in the room. They're important for women. They're important for the babies.
Yes.
And I think that during COVID, there was a unique opportunity to use the support from a partner.
Right.
When women's support networks were very limited elsewhere, in other senses, because they couldn't socialize and they couldn't engage with their friends and parents groups and things like that.
Yes, it was.
So that's why we looked at them specifically. We looked at partners specifically, and as you can see, they were quite significantly impacted by the restrictions.
Yes, and I guess in a country like ours, it is even more severe, the impacts, because a lot of partners, even by choice, don't come to the hospital because of the risk of COVID, as well as there are many, many discordant couples where, you know, the woman is positive and the husband is not, or vice versa.
Yes,
So
I can imagine it would be very difficult in your country, Mala.
Yes, yes. So it does mean that this is an important area to study. And thank you for looking at this. I'm sure you'll carry this forward.
I appreciate your support. Yes, I am a great advocate for studying partners. Yes.
Yes, yes. And I was just thinking whether, I mean, you have chosen one method of survey online, but whether interviews on the ward would be also a good idea, because that's very fresh, the experience.
Yes.
And I think that may be added on to your study and it'll validate it more.
Yes, I agree. Under COVID restrictions, the fathers in some states were not allowed to stay on the ward.
Yes.
So straight after the birth, they had to leave. So we were not able to do it under the restrictions. But yes, certainly that is a very good idea for when we all come out of this pandemic,
Oh,
hopefully soon.
You are the lucky people. I think Australia is doing very well.
I know we consider ourselves very, very lucky. It was a very tough lockdown, but we are very lucky.
Thank you.
May it be so.
Thank
Dr.
you.
Mala?
Thank you, Karen.
Thank you. Lovely to talk to you.
Mm-hmm.
Thank you, Karen, and thank you, Dr. Mala. Can we move over to the next one?
Yeah.
Okay, and the next paper we have is the number 060, and the author is Laura. How do midwives conceptualize intrapartum risk? And Laura, are you here? And if you can just unmute yourself, and over the next 5 minutes, your time.
Yes, I'm unmuted now. Hope you can hear me.
Hello, Laura.
Hello there, Dr.
Very, very interesting paper. You introduced a very new concept of phenomenography. And
yes.
That is something that I learned new from your paper.
Okay. And
the question I wanted to ask you is, how will your research help midwives negotiate this risk that you're proposing?
So to negotiate the risk, I think we needed to get an understanding of it. So a lot of what came out of my research did actually confirm a lot of what we already know about risk. Mm-hmm. There's lots of confirmation of things that we do know, but what's new about this research is how midwives understand intrapartum risk. So it's that structural way of understanding how risk is. Mm-hmm. And I think an understanding in itself will help midwives to understand why there are differences between themselves and their colleagues. And I think that's really important in education, for student midwives, but also for current registered midwives. So sort of more education around what other midwives are doing and so how different conceptualizations might impact on their practice.
Mainly, I think it is the junior midwives that you need to really give the solid support to let them blossom into, accomplished senior midwives.
That did come through in the research. So the junior midwives weren't feeling supported, and of course the more experienced midwives recognised that themselves as a risk. So that's definitely something that's come out and was a recommendation.
Excellent. So I think you could explain one more time to all of us who didn't know what is phenomenography.
It gets very confusing. Some people have heard of phenomenology and often think phenomenography is the same. It's slightly different because we're trying to capture the variation in how a group of people understand a phenomenon. So not trying to define what intrapartum risk was, but to try and find all the different ways that midwives described and experienced intrapartum risk. That's what phenomenography is.
Mm-hmm. Right. That's good. Are there any questions in the chat box for you? Let me check. Is Dr. Jean on? He might have a few questions on this. So one of the concepts that you had mentioned in your paper was that they felt like middlemen between the woman and the obstetrician. And I think that chain or that link has to be very strongly bonded for everyone to not feel the risk implicated, right? From the woman's end, from the midwife's end, and from the obstetrician's end. And I think that cementing is what we need to really work on. And that would lift the weight off a lot of shoulders, I'm sure.
So definitely the relationship, particularly with a known midwife, was shown to be very protective against risk in the intrapartum period. So the more continuity of care relationships we can have with women, so between midwives and a woman, is certainly strong, and the outcomes are very clear for women that they'll have better birth outcomes, and midwives feel safer working in that space.
And one of the concepts in the presentations that came through was that during the COVID pandemic and the teleconsultations, that rapport was getting a bit thin because midwives would come straight to the point and they didn't have time to kind of build a rapport with the woman. And I think that is what we need to protect during these COVID times as well. I'm sure these times should pass soon.
definitely. So having that known midwife would certainly help in that.
Yes, a known midwife would certainly help.
Yeah.
Thank you. Thank you, Laura. I think that was a very good presentation.
Thank you, Dr. Mala. Thanks for having me.
Thank you, Laura. I really enjoyed your presentation, and we had a little time to look at them. That was the nice part of this conference. And thank you. The next part of the person who's going to go up is 0184, Dr. Tazeen, Pregnancy Outcomes and Birthing Experience with COVID-19, a tertiary care study, center study.
Yes.
Good evening, ma'am.
Hello, Tazeen. Is it Tazeen?
Ma'am. Good evening.
Is it
Tazeen?
Tazeen? Yes, that's what I thought. Your paper was very interesting because you have presented, in a country like India, a very positive outcome during the COVID pandemic of a very low cesarean section rate and a high vaginal birth rate. So I must compliment you for that at Trivandrum.
Thank you, ma'am.
The question I had for you was, what do you think are the reasons for this high percentage of positive experiences that your patients had, as compared to so many other centers that are reporting a very high cesarean section rate?
Yes, ma'am. Actually, we considered all the aspects of the positive childbirth to be included, incorporated, and it should be available to all the women, despite of the status of being COVID positive or negative, despite of their screening status. And also, for the sake of that, we created a separate labor room, like it was especially for the COVID positive patients, and it had all the amenities, all the supporting staff, and everything as we have with the usual labor room. And those patients who were found out to be positive, they were dealt there with all the obstetricians. Special staff was recruited, including the doctors, consultants, nurses, midwives, everything, and all the facilities were available there. And they were taken care of in a very gentle, kind way, because COVID as such, the status being positive in itself adds a lot of fear, apprehension to the patients regarding the risk to their health, their baby's health, their labor process. I mean, anyone in that position would feel the same and would really be very, in a sense, scared and anxious.
Yes.
So all those, their queries, even by the neonatologists, they had special postings in the COVID labor room for attending all the.
Question was, what was the ratio of the patient and nurse or midwife at your unit? Because you did come across giving very, very efficient care.
When we provided 1:1 care.
That's what I thought. Okay. And the other question was, when did you fill out this questionnaire? Was it before discharge or soon after birth?
No, ma'am. On the day of discharge, before the processing of discharge was done, the patients were asked to fill up a form and share their experience. How was it? Because this was something new we had set up in our institute as a separate labor room. So we also wanted a feedback, how we can improve and what are there would be some shortcomings on which we can work upon, and then provide the other patients with a better facilities and quality of care, I would say.
So the only other comment I had to make was that the preterm labor incidence you quoted was 9% in your patients. But many people are now saying that it is equal to, because as their anxiety is allayed, as they feel cared for, the preterm labor is likely to go down. You said fetal distress was not increased, and that is why you had a high number of vaginal births, and 91% of your patients reported a positive birth experience, which is, as I said, a very high number, and I must congratulate.
Out of the 35 patients, madam, ma'am.
Yes, although the number was small. So I just wanted to say.
That was the.
Dr. Sarita, and the title is Assessing Effectiveness of Safe Delivery App in Public Health Segment Facilities of Bihar. Dr. Sarita, are you here? Can you please unmute your mic?
Yes, I'm unmuted, ma'am. Hello.
Thank you so much.
I'm here only.
Yes, Dr. Sarita. I went through your presentation and I wanted to ask you, is this app available only in Bihar?
No,
Or
ma'am.
is this app available only in the state of Bihar? Is it a state developed concept or is it a national?
No, ma'am. It's not only available in Bihar. It's a global product.
Okay.
It's a global product, and it is being customized for our language only.
Oh, okay, okay. So globally, it is called the Safe Motherhood app. It is called the Safe Delivery app, SDA,
Yes, ma'am.
and
It is
it's
known as
available.
Safe Delivery App.
Safe Delivery app. Seems a very useful tool to have on your phone because it tells you everything, your dosages, your protocols for managing high risk pregnancy. And it has a total of 12 clinical modules, you said.
Yes.
And there is one on COVID-19 as well, which is extremely good to have. And the best thing is that it doesn't require internet because you can, once you download it on your phone, you can work it without internet. I think this definitely you need to popularize this. I felt this was a very handy app for a lot of nurse practitioners, midwives, doctors, when they are on the labor wards. You did do a study which showed that the pre-test score of the people using the app and the post-test score showed an improvement. Although the study numbers were small, but it was heartening to see that it did show an improvement. And I think what I liked about this was the action cards in the app, which tell you exactly the steps to follow if you have postpartum hemorrhage or preeclampsia, right?
Yes.
So what is your personal experience of using the app?
As per personal experience, you may say that is extremely satisfying once you ask someone in your facility when you are visiting or you're addressing them to use this app. It is so simple. It is going through your not only the data, but also they are showing the videos, the uh, so it's very useful, ma'am.
आवाज याचा येत असेल ना कम्प्युटरचा
Okay. Very good. And any suggestions you have, how can we improve or what should be on the app, which you don't find on it currently?
Right now, what we need in our labor room, I think most of them are there, but the user friendliness feedback actually should be there. If they want some improvement, they
Yes.
can give some feedback.
So you think that part needs improvement, the user friendliness of the app?
So that user may also can send some feedback.
Right, right. Okay, so it's called the Safe Delivery app. And I know there are a few others also developed in India, like Safe Matritva, Adbhut Matritva, which talks about antenatal exercises, but this one is totally looking at intrapartum care.
Yes.
Right? Mm-hmm. So good. So the user friendliness needs improvement. I think it's important that we take a feedback on anything that anyone thinks is missing from the app, because I myself have not used it. I will not be able to judge it for you. But I think you need to take a feedback on people that are using the app so that we can continually improve it.
Yes.
Yes. Yes, thank you, Dr. Sarita. I think for the government or the public sector, this is an extremely useful app. I wish most states would use it. I've not seen it in the state of Delhi where I am, but I will certainly tell people about it.
It's so simple. You can just download it from this. I think it's need scale up also. So we are also thinking.
So you download it from the App Store.
Yes,
right?
ma'am. So
Yeah.
simple. You can
So
just
both for Google and iPhone.
everywhere in the both, and you can choose your language. You can choose.
And you can choose the language.
Yes.
So How many languages is it in?
Plenty of languages, Doctor.
Okay, that's excellent.
Thank you, Dr. Sarita and Dr. Mala. Okay, can we move on to the next one?
Thank you, madam. Thank you.
Thank you.
Thank you.
Thank you, Sarita.
The next person is 101, Julia. Comparison of accuracy of ultrasound of estimation of fetal weight versus clinical examination. Very interesting findings.
Mm. Yes. Hello, Julia. Are you with us? Oh, we have Victor here now, who we missed. But Julia is not here.
Do you think we can go over to the Victor's paper and then come back to Judy?
Right. Go back to Victor, please.
Yes.
So, hi, Victor. Can you hear us? Can you see us?
Hi.
Hi.
I can see you.
Okay, so just to introduce your paper, Victor, the number is 196, and his paper was on antenatal care and anxiety among pregnant women with COVID-19 in Brazil, a cross-sectional study. We were looking forward to your study. So the next 5 minutes are yours.
Mm-hmm. Okay, Victor. It was a very interesting study, a cross-sectional study, but only a convenience sample. And I thought we should have a more cross-sectional sample rather than a convenience sample. Your study did highlight the high level of dissatisfaction in antenatal care during the COVID-19 pandemic and the high level of anxiety. But what bothered me was that the average survey time of your study was 24 weeks of pregnancy. Yes?
Yes.
Yes. So that means it is not covering the later part of pregnancy when the buildup of anxiety is much more as the delivery is anticipated.
So, but the mean was 24, but the
range was
10, and there are so many pregnant women with the mean of age with gestational age, with
up to
early pregnancy and delayed pregnancy. So the sample was very varied.
Okay. Okay. I get your point. The mean was 24. Perhaps the mean does not mean much in your study. It should be the range from which gestation to which gestation, right?
Yeah.
You have any such scoring done before the COVID pandemic? Because it would be nice to compare what was the satisfaction score with antenatal care in your area before the COVID-19 pandemic and how severely it has been affected now.
So we using the we have a search on the literature. So we comparing the mean of pregnant women in the literature before the pandemic, and the mean of anxiety was very low. In the low pregnancy. So we compare with the literature when between the our research.
Okay, so I get your point. So from literature search, you know that the scores of anxiety were much lower before the pandemic, and now in the same population, you know that the anxiety scores and dissatisfaction score is much higher, right? And I think the same has been echoed by a lot of other presentations So your findings are very valid. Your study is very valid and comes to a very valid conclusion. Do you have any questions, Dr. Jean, to ask Victor?
Yes. Victor, could you speak to how much you think these findings are unique to Brazil in the context of birthing in Brazil as compared to other settings?
I think the research shows the deficit on the antenatal care. So we have so many points to work and work harder to invite the complaints of the
I'm sorry for the signal.
Yeah, I didn't know if that was me or him.
We're sorry.
Oh, we are all not able to hear him. Sorry, Victor, you repeat yourself, please.
Okay. The research, the findings of research show of us the lack of communication between the professionals and the pregnant women. So that's a point that is important to work and work hard in the future antenatal care with pregnant women in the pandemic.
Okay, thank you.
Yes.
Thank you so much, Victor. Dr. Malak and Eugene, can I go ahead with the next one? Julia is not to be found in the Zoom room. Do you think we can move over with the next set of people? And they seem to be in this room.
Okay.